Side glide of the lumbar spine is a movement that I did not learn until I was introduced to ROM and McKenzie's work after graduation. Side glide can be left or right. The other two primary motions of the low back are, of course, forward bending or flexion and backward bending or extension. To test side glide, I have patients put their feet under their shoulders, one hand on the pelvis, and glide the pelvis as far as it will go to one side, and then the other side. Common mistakes are that people will make it a bending motion, and we're not trying to bend, we're trying to glide the lumbar spine on the pelvis. Now, when I test it for patients, I typically have them do it actively, assessing for quantity and quality of motion, meaning how far does it go and does it hurt either during the motion or end range, and where does it hurt. After they do it actively, I typically stand behind the patient, stabilize them, and push them passively so that I can better assess for the quantity of motion. It's hard for me to instruct people on how far a side glide goes. I have a good idea of it because I've been testing it on thousands of people over the years, but suffice to say that absolutely it should be symmetrical left to right and pain-free. So for aberrations in this movement, if it's not gliding fully, if it's not pain-free, we will take that as a baseline and reassess after we do the repeated movement testing. For all motions, we should not have them becoming tighter or more painful or overall stiffer. What we should see if we have the right directional preference movement with repeated movement testing is an improvement in either the quality and or the quantity of the movements. So when we do side glides as a repeated movement test, we usually do them against the wall to stabilize the trunk for the movement. But when I'm testing it as part of the baseline testing, I'm doing it, like I said, in freestanding, actively first by the patient, and then usually passively.